So also this morning, some new reporting shows some patients who received a coronavirus test are now being hit with thousands of dollars in unexpected medical bills. NBC's Vitali is joining me now with the latest on that. Lots of concern in what I think you're about to share. What's going on?
Yeah, Alex, COVID-19 testing is expanding across the country, but many Americans are finding out free may not always mean free.
People that are getting tested are getting this free.
True in theory, but in practice,
I'm still getting bills. I'm still getting letters from the hospital.
23-year-old Carberry Campbell came home to Florida after teaching in Spain in March. When she started feeling sick, her family physician recommended the closest coronavirus testing site.
They told me that they were going to give me a flu test and a strep test in addition to the coronavirus test. I assumed that those would be free as well because they fell under the jurisdiction of coronavirus testing and related costs.
Then the bills came. After insurance paid, the hospital said she still owed more than $3,000 for the extra tests, scans, and blood work.
I had gone to the hospital and assumed that it was going to be free, or that they were going to kind of warn me if there were things and ask me if I wanted things like a chest x-ray that were going to cost additional amount.
Timothy Regan was also showing symptoms, eager for a test to better protect his pregnant wife and one-year-old son from getting sick. A nurse's hotline advised him to come to the hospital.
I spent hardly any time actually seeing any doctors or anybody.
He was tested, but not for coronavirus. A hefty bill soon followed.
No one said anything about any cost whatsoever. They told me they were doing the tests. They didn't ask me if I wanted the test.
To some patients' advocates, it's a costly reminder of a flawed healthcare system.
What other sector of our economy are we blind to know prices before we buy or get care? We're being expected to pay with a blank check and have no negotiating recourse because we never knew the price to begin with.
Polls show Americans overwhelmingly support price transparency. But so far, bipartisan backing on the Hill hasn't led to long-term solutions. And efforts by the Trump administration to compel hospitals to release their prices are tied up in court. The American Hospital Association saying the plan, quote, will at best confuse patients. It is also enormously burdensome, requiring hospitals to devote significant staffing and financial resources better used for patient care. Still, as officials urge Americans to get a test,
Get tested.
some are finding the lack of transparency is hitting them right where it hurts the most, their wallets. And, Alex, we went through both Carberry and Timothy's bills. They were confusing. But instead of paying these bills right away, they questioned why the charges were there in the first place. Both have since had insurance pay for these bills in their entirety, but that's only after they spoke out about them publicly.
Okay, Vitali in D.C., thank you for that.